As all of you know, the COVID-19 pandemic has moved fast, which of course has meant that the government has had to act swiftly at every step of the way. When we put in place the wage subsidy scheme just over a week ago, we said we would continue to monitor the scheme and make changes to it if we need to, and we have. On Monday, we lifted the $150,000 cap on the scheme so workers who are employed by medium and larger businesses could also get the benefits. Today I am announcing some modifications that we have made to the scheme to ensure as many people as possible stay in their jobs. These changes are further measures from the government to soften the impact of COVID-19 on workers, families and businesses and position us all for the economic recovery once we exit level 4. The following changes apply from 4 p.m. today. Firstly, the current sick leave scheme is being folded into the wage subsidy scheme to prevent double dipping. The scheme was designed at a time when we had very few people unable to work or self-isolating. Clearly that has now changed. We are, however, looking into a sick leave provision scheme for essential workers, particularly those aged over 70 or who have compromised immunity, and we'll have more to say about that in the coming days. Secondly, the requirement on employers to make best endeavours to pay their employees 80% of pre-COVID income remains. However, if this is not possible, then employers who take up the scheme must pass on the entire wage subsidy to their employee. I want to be clear, this applies to all workers. All workers must receive at least the full value of the subsidy. Even if the lockdown requires businesses to operate with no activity, the subsidy allows them to keep their workers on the books. It is vital that we keep an attachment between employers and workers so that a recovery can start quickly. So thirdly today, we are also saying that we are requiring employers to keep employees in employment for the period of the subsidy. The changes that we are announcing today take the potential cost of the scheme from between $8 and $12 billion. Clearly that will vary depending on how many businesses take it up. It's not a cap and it's not a floor, it's merely an estimate of the amount of money that we believe the scheme may cost. I want to make it clear to employers, nothing in this scheme overrides your legal obligations, including to pay for any work completed at the wage rate agreed between you and your staff. We have had a lot of questions about leave. The scheme does not change any legal obligations employers have. Employees should not be compelled to take their leave to receive the subsidy. We are running this scheme in a high trust model in order to get money out the door to support workers, families and businesses who are affected by COVID-19. We will soon begin publishing the names of firms who have received the subsidy as indicated to them when they applied for the subsidy. As I said yesterday, I want to hear from anyone who believes an employer is taking the wage subsidy but not passing it on to their staff. This is a high trust model and we need to work together to get through this and be ready for when the economy begins to recover. I just want to say two other quick things before I finish. The first of those is to update again on numbers in terms of what has been done. As at this morning, $2.7 billion has been paid out to 428,768 workers. I need to stress again that the demand for the scheme is very high. People involved at the MSD are working hard to respond and process applications as fast as they can under challenging conditions. I want to again thank the Minister of Social Development, the Honourable Carmel Sepuloni, the Chief Executive of the Ministry of Social Development, Debbie Power, and all their staff for the extraordinary work that they have done to process that many applications. It is to try to be patient and be kind to one another. All of these people are working as hard as they can. And just on one very minor point, if I may, Prime Minister, just to confirm something I believe Patrick asked yesterday, the mortgage repayment deferral scheme is open and underway. All the banks are taking applications for that from today.
Over the past few days, we have been discussing the importance of personal protective equipment, or PPE as it's called, for our frontline health staff and also for our essential service workers. They are looking after us, and so we in turn need to make sure that we are looking after them. So I wanted to give you a few more specifics around our PPE stock in New Zealand. The Director General of Health, you may have seen included in his press statement this morning, some of the stocks that are currently held in New Zealand. DHBs hold 5.1 million masks, 1.9 million gowns, 2.7 million pairs of gloves, and 60,000 items of eye protection. In addition, the Ministry of Health has a national reserve of 18 million masks. Yesterday, 640,000 masks were released from the National Reserve, and today, I'm told, were sent to DHBs to replenish their stocks. Over the next month, the Ministry of Health will be supplying 4 million masks to the health sector and a further 4 million masks to non-health sector essential workers. We're also working closely with a Whanganui-based manufacturer of masks who helpfully in New Zealand produce 60,000 masks a day and 45,000 what are called N95 masks. Those are masks specifically used by our health workers and are the next level above the surgical masks that you might see day to day. We are actively assisting them, I'm advised, with distribution logistics so that they can focus entirely on production. The Ministry of Health is compiling a priority list so essential workers at the most risk of contracting COVID-19 receive masks and personal protective equipment first. DHBs are being given refreshed guidance on the appropriate clinical use of PPE to help them plan usage and ordering. As you may have heard me mention yesterday, we still have some work to do with the distribution aspect of PPE, but I know that this is a priority for those who are leading our response operation and will include the normal supply networks and working with new private sector support to just continue to grow our PPE stocks. I also wish to follow up on some of the points that Director General Ashley Bloomfield made earlier today about the continued rise in the number of COVID-19 cases in New Zealand. As I have said many times before, sadly, an increase in cases is expected. In fact, it is the whole reason why we are in a lockdown. What we are seeing now are the cases already in New Zealand before that lockdown started, and these will keep showing up each day and will continue to rise for at least 10 days or more, and I'm expecting that those increases will continue to be steep. However, if we keep to the lockdown rules and limit our contact with others, we should start to see the impacts of that, if we follow the rules. I want to remind people again why it's so important. If you today have COVID-19, you may not know that for several days. Decide to walk with a friend, not in your bubble. That friend then visits a family member, not in their bubble. That sets off another chain of transmission that will still be showing up weeks from now. So I say again, please stay home, break the chain and save lives. I also want to use these briefings to draw attention to and acknowledge some of the extraordinary efforts essential workers are undertaking in the fight against COVID-19, and there are many unsung heroes across New Zealand. I will do my very best to acknowledge just some of them as much as I can. Today, I want to single out our medical lab scientists, a workforce of 1,823 at 8 labs across the country, processing incoming tests 24 hours a day, 7 days a week to get the job done. They're on separate shifts and separate teams and on rotating rosters to help preserve physical distancing and stay safe as they carry out this vital work to help in the tracking, tracing and elimination of COVID-19. And while their work is around the clock, it is also continually notching up our gear. As testing ramps up, which in the last 7 days has averaged 1,479 tests a day, so too must our labs, with 3 more currently being set up. These lab staff are working tirelessly to ensure we know the true scale of the outbreak and to ensure those with COVID-19 get the appropriate care. I want to say on behalf of New Zealand, thank you for your work.